Okay, so flexors and extensors. And actually, let's do a really quick top hat question. Or actually, ooh. Okay, maybe this is kind of out of order, but all right. So let's see what people said. So, ooh, it's almost half half. Wow. So anterior thigh and lower leg at the knee. So how do you expect the muscles in the front of your thigh to move your knee when it contracts? Well, it will extend your knee. So why do I bring that up? So remember the knee is kind of in reverse, and sorry it was a little tricky. I think some of the question order got messed up a bit. So remember this part, I think this is my pre-recorded lecture, but again, here's a different joint. Here's the elbow joint, but where would you expect to find the flexors? Would you expect to find it in the front or in the back of the arm? Well, again, if you're flexing toward the anterior, it would make sense to have muscles that cause flexion to shorten that angle, right? So, not coincidentally, the flexors are on the same side as the direction of flexion. On the opposite, you have extension, the opposite movement of flexion. So it makes sense you would have extensors on the other side of the arm. Now let's see. So this is what we have here. So notice that, hey, we're looking at the front of the arm. So now I know the question was about the thigh, but now let's continue with that arm example. So notice that all the ones in here in the front and the anterior, remember that all the movements toward the anterior, at least in your upper limb, these move toward the anterior. This causes flexion. And what do you notice about all these muscles here in your forearm? Hey, what do they have in their name? They're all flexors. So again, when you flex your arm or your hand at the wrist and also flex your fingers, what happens is that these flex toward the anterior. So it makes sense all these flexors would be on the anterior. And if you look on the other side, what do you notice on the forearm? Well, most of the forearm muscles in the back, they are, not coincidentally, extensors. Because again, if extension goes toward the posterior in these joints, then it would make sense that the extensors would also be in the posterior. The flexor carpi ulnaris is just here because it's kind of on the side. So you can still see it from the posterior, but what I'm getting at is that most of these are extensors. Because why? Because you extend toward the posterior, it makes sense that the muscles would also be on the posterior. Now, gluteal muscles, and this is interesting. So I remember one semester a girl asking me, like, or one of the female students asked me, is it true we have three butts? And I'm like, wait, what? And then I was like, oh, I think she's talking about gluteal groups. So yeah, we talk about our glutes, but it's not like we're talking about our glutes singular. We're talking about our glutes as a group. So your gluteal group, you probably know about your gluteus maximus. And remember, this is another one talking about size. So saying your biggest glute, your biggest of all those three glutes. Then you have your gluteus minimus, and you can't see it in this. So this is like a superficial. So the gluteus minimus is actually hidden behind this gluteus medius and gluteus maximus. So this is what we see on this side. So you actually have three gluteal muscles per side. And then the gluteus medius, so like medius is medium, so it's saying like large, medium, and smallest. So that's why, yeah, that's what that female student was getting at when she asked if like, is it true we have three butts? And I'm like, yeah, they're probably referring to pairs of gluteal muscles. So yes, your gluteal group does have three layers. But again, this is why you can't see the gluteus minimus from here. It's covered up by the gluteus maximus and medius. Okay, so obturior, internus, and externus. Again, that rule of opposites. One's more internal, one's more external. So remember the pelvic girdle, and if you look at it from the anterior, it kind of has like those little holes right there. That's called the obturior foramen, right? So notice where they're attaching to. And then you have the iliaxis and psoas major. Sometimes so this is again why there's a big, like, how many skeletal muscles are there in the human body? Some books list this as just one muscle, so they just call it the iliopsoas, and some list it as separate muscles. Again, do I want you to know what, do I care either way? No, I just wanted you to know, like, hey, the iliacus makes sense. It's on the ilium, and the psoas major, you just kind of got to know that one. But that's just more FYI. And then, okay, now we're getting to our pack question. So what we have here are the muscles that move your leg, and these are your quadriceps. So what you have here is your rectus femoris, that big one right here, and vastus lateralis, so medialis. So they're vast, they're big, but one's more lateral to the side, one's more medial. We're looking at the right leg. So this would be the midline of the body. The medialis is toward the midline, lateralis is away. There is a vastus intermedius, but the thing is that it's being covered up here, so you can't see it in this picture. So why is it quadriceps? There are 4 muscles, but right now one of them is being covered up. And if you take advanced classes, they might talk about the 5th and 6th quadriceps. Don't worry about it for this class. Just know on the classic, the 3 vastus muscles and the rectus femoris. And yeah, so then, and actually some of these we did already cover, like the adductor longus and gracilis. So even though it seems like there's a lot of muscles, when you start knocking them off, eventually you'll be able to like, oh, I kind of know this. Just another way of looking at these muscles. So quadriceps in the front, hamstrings in the back. So what we have here is this biceps femoris, and it is just one muscle, but it has 2 heads. Again, 2 origins, 2 heads. Semitendinosus. Semi, like when you have like something that semi is a prefix meaning half. So what it means is like it says it's like half tendon. So notice it's kind of like very skinny here. Semimembranosus. Membranes again are flat sheets, so it's like saying, okay, this one's kind of like half like a flat sheet. And then you have popliteus. Hey, that comes from popliteal, right? And okay, and then now we're finally at the foot and the toes. So tibial said, I think on the study guide it said ankle flexors and ankle extensors. Hey, so this is why I also say, like, in terms of flexion and extension, most joints are toward the front and anterior. But the thing is that ankle flexors is when you have to use that decrease the angle between 2 bones. And what we have here is ankle flexion. So ankle flexion is actually kind of the same thing as dorsiflexion. So it's going to move this dorsum of the foot up here. And luckily, there's only one prime mover. So we only have the tibialis anterior. Hey, where is it? In front of the tibia anterior. Now over here, you have your ankle extensors. And notice that on the opposite side of the tibia, that's where you have all the extensors. So notice that flexors and extensors are, again, typically located on opposite sides of a bone. And here we have the gastroc or gastrocnemius. This is the most superficial. The soleus is actually sandwiched. So it's not that, it's actually very important in, if you remember all the way back to like the 1st, 2nd, and 3rd class levers. So they work together with all these ankle extensors to do plantar flexion. So plantar flexion is kind of like the same thing as ankle extension. They're kind of used synonymously. All right, and I think that's it. Oh, retinaculum. Why did I bold this in this picture? So it's not actually a muscle, but whenever you see that term retinaculum, it's like a band of collagen. But notice that it's kind of holding all these tendons in place. So the tendons actually slide underneath the retinaculum. Here we have a superior extensor, inferior extensor. That's more like stretch goals for your future classes. But again, this is also important. It's not just about the muscles. Notice that some of these muscles have a lot of these, like sometimes they have like thin tendons or long tendons. Sometimes they have sheets of dense connective tissues. Sometimes they have other sheets of connective tissue that help to hold all these tendons and aponeuroses in place. But for this class, focus more on muscle anatomy for chapter 11. All right, so I think that's all we have for today. So Wednesday Wednesday, I think there should be a FAQ open on Top Hat. So I'll be using that to collect the answers. And remember, you can upvote some questions and the ones that get upvoted more, I'll answer them from the start on Wednesday's review session. And Friday's exam will be very similar to the first exam. So there will be a window, but it's 50 minutes, 50 questions, and 50 points per question. Pretty straightforward, all right? Okay, so see you if you will. Again, Wednesday, this is the last new information we're covering for this before exam 2. So Wednesday, not mandatory, all review, no new information. And again, use Top Hat for the FAQ, and see you on Wednesday, all right? Okay, take care and stay healthy until then.